Welcome back to Stem Cells Unveiled, from basics to breakthroughs. I'm Dr. Sukant Khurana, your host, and we are on episode 4, Regeneration Revolution, Stem Cells in Tissue Repair. Returning to lead us is Basudha Banerjee, our stem cell regenerative medicine collaborator who's been lighting up this series. Basudha, take us into the world of tissue repair. I'm all ears.
Dr. Khurana, I am so excited for this one. So we have covered what stem cells are, how they work, and where do they come from. And now it's time to see them in action, revolutionizing tissue repair. I am obsessed with how these cells can rebuild the skin, cartilage, muscle, bone, you name it. It's like a nature's repair kit. We are just starting to tap into it. So let's dive in with the applications. So do you want to pick a tissue to start with?
You are running the show, Basudha. I'll toss out skins such as such a visible vital example. Go for it.
Okay, skin. So that is a fantastic place to begin. So stem cells in the basal layer of epidermis, those epidermal stem cells, they are constantly dividing to replace the dead skin cells that we shed on a daily basis. But the real power shines in regeneration. Think of severe burns. Stem cells can be harvested from a patient healthy skin, expanded in lab, and used to grow sheets of new skins or grafts. It's life changing. Then there is also cartilage. It is sort of tricky because it does not heal well naturally. Mesenchymal stem cells, often isolated from the bone marrow or fat, they can also differentiate into chondrocytes to repair the damaged joints, any cartilage issues, especially for conditions like osteoarthritis. I've also known few lab cultures where these cells from cartilage-like tissues, it's unreal. And so, what is your take on cartilage repair, Dr. Prana?
Well, it is a tough nut to crack, but those mesenchymal stem cells are a game changer, turning a non-regenerative tissue into something we can rebuild, and I absolutely love that.
Right. And it does not stop there. Muscles next to skeletal muscle has satellite cells, a type of stem cell that sits quietly until the injury strikes, like a torn muscle from sports or, say, any casualty during the military casualties. So these satellite cells, they activate, proliferate, and they fuse into new muscle fibers. I've read plenty of studies where boosting satellite cell actively it speeds up their recovery. Imagine that for athletes. Then for the bone, we have mesenchymal stem cells again forming osteoblasts to knit fractures or rebuild bone loss to any sort of trauma. It's wild how versatile these cells are across tissues. So, Dr. Kurana, any tissue application you would like to highlight?
Well, bone is a big one. Fracture healing with stem cells is already in clinic and shows how practical this can get. One of my cousins who's relocating away, he's actually quite involved for last 10 years, been in various government hospitals in India, now resigning, moving there, has been a good researcher with UK, Spain visits, collaboration. He's been working on a lot of diabetes related problems in feet and exploring, obviously this is more at a research level, how stem cells can play a role in some of the fractures when diabetics where they are problematic. So I can see how game changing it is and how quickly they are getting to from labs to clinic. In fact, that transition also is lightning fast compared to what used to be earlier. So it is as practical as it can get, Vasudha.
Yeah, I mean, that's totally practical using the bones for, or rather, the mesenchymal stem cells for bone regeneration. And this brings me further to the case studies because this isn't just theory anymore. Take the example of bone victims. There is this amazing case where a patient with over 70% of the body bones got a stem cell derived skin graft. Autologous epidermal stem cells were cultured into sheets and then applied, cutting the healing time dramatically. I get chills thinking about this. Then joint repair. So think of an older patient with a knee cartilage damage. So, injecting mesenchymal stem cells, often from their own adipose tissue, has shown to reduce the pain and improve mobility in trials. Then on the list, we also have a lot of sports injuries. A pro athlete with a toe, Achilles tendon, he got a boost from platelet-rich plasma mixed with stem cells, and this speeded up the repair process. So these stories, they blew my mind, like real people, real results. So any case that is stuck with you, Dr. Khurana?
Yeah, burn victim cases are incredible. Some clearly, I know. Then add sports injury examples, footballers with ligament tear, stem cells injections. In fact, science communicator who used to be a friend, not a very close friend, John Reeve Smith, UT Austin. She's, I think, back in Canada. She had a ligament tear, I heard from common friends, and did go through a stem cell thing, which was being given as clinical trial back then and benefited. So there are, I know of several cases of tangible progress, not just through media, through my network of U.S. universities, friend circle, doctor network, in India, in US, in UK. So it's very, very tangible. I can see the excitement. It's very palpable. So I'm loving this tangible progress.
Yeah, tangible. That is the word. So now let's zoom into the current therapies because some of this is already standard practice. Bone marrow transplants are the poster child, used for decades to treat a lot of blood cancers like leukemia. Hematopoietic stem cells from the marrow, or sometimes cord blood, they repopulate a patient's blood and immune system after chemo wipes it out. The mechanism is elegant. Those stem cells move to the marrow, engraft, and start differentiating into erythrocytes, leukocytes, and all of the other blood cells. I've read multiple papers and I've also seen data. Survival rates of some leukemias have soared because of the stem cell transplant. So, what is your angle on how these transplants work?
So this is, all this is about homing. Those stem cells find a niche in marrow driven by chemokines like STF1, then proliferate and differentiate. It's a very beautifully orchestrated process.
Well, that is beautifully said. The homing piece is critical. The signals guide the cells right where they are needed. And it is not just blood. Mesenchymal stem cells are also in the trials for everything from spinal fusions to heart repair post infraction. Those are still experimental, though. The mechanism is quite similar. They deliver the cells, let them integrate, and it triggers regeneration. What excites me most is how these therapies build on natural repair, like amping up what stem cells already do. Challenges remain, though, like ensuring engraftment or avoiding immune rejection with donor cells. And then we also have the issue of immune reconstitution. But the innovation of the charts. Dr. Khurana, what's the next frontier you see here?
So you raised some very interesting, points. I am, you covered it very well. But let's sort of, I think the next thing is scaling up, which I see in everything. See, earlier, when I was a professor and a scientist, I used to not understand fully until I became an entrepreneur of what it takes to scale up things. So, making these therapies routine, affordable, and precise, scaling up in that way, that's where we are headed, and that's the biggest challenge, especially for autologous approaches.
Yeah, I mean, scaling up, that's the dream, right? So, regeneration revolution is just starting, and I'm buzzing with how it's transforming lives already, honestly. From skin grafts to bone marrow transplants, stem cells are rewriting the repair process. So, thank you for letting me lead this. It's been a thrill to geek out over these breakthroughs.
Yeah. So you're very natural, Vasudha, at this. That's episode 4, folks. masterfully led by Basudha Banerjee. Next time, we'll explore stem cells in cardiovascular health. If you have questions, message us in the comments. Let us know how we can improve, what are the topics you want to hear. And please subscribe to us, follow us, share with your friends. Thank you very much. It's been a pleasure having you here and discuss this amazing topic.